Hi everyone, we are the Preventanyl iTEAM and our social innovation project is focused on using fentanyl test kits to improve the healthcare of Canadian drug users in light of the current synthetic opioid crisis. Our iTEAM includes myself, Mason, as well as Campion, Robert, and Martin. Just a quick overview of what I'll be discussing today. First, I'm going to give a quick introduction on the synthetic opioid crisis, our social issue prompt, the sustainable development goals we hope to address, and the logic model we are working with. Next, I'll discuss the key findings from our rapid systematic review, as this underlies the assumptions and evidence of our logic model. Following this, I'll introduce our social innovation, fentanyl test kits, and the required inputs and outputs. Lastly, I'll discuss the short, medium, and long-term outcomes of our social innovation, how these will be evaluated, and other external factors and potential unwanted outcomes. Briefly, the opioid crisis encompasses the rise in opioid-related overdose deaths due to 1. The emergence of extremely lethal synthetic opioids, specifically fentanyl, and 2. A history of high rates of opioid prescribing. In 2018, there were nearly 4,500 accidental opioid-related overdose deaths in Canada. This is more than twice the number of deaths that result from traffic collisions every year. And important to note, the opioid crisis also exerts a financial burden of $313 million every year on the Canadian healthcare system. It goes without saying that we need to take action now, because if we don't, we risk an additional 4,500 deaths in 2020. Fentanyl is a lethal synthetic opioid roughly 50 times more powerful than morphine, and it's responsible for the vast majority of accidental opioid-related overdose deaths. This graph is showing the number of opioid-related overdose deaths from 2016 to 2019, and the green aspect of the bar highlights the proportion of deaths that are resulting from fentanyl. With the current synthetic opioid crisis in the back of our minds, we were attracted to prompt number 84 from the United Nations Development Agenda. What are the most effective approaches to reduce stigma-based discrimination by health workers toward vulnerable groups? However, we modified the prompt to focus on how can we improve the healthcare of drug users in Canada in light of the ongoing synthetic opioid epidemic. Targeting this prompt effectively addresses 3 of the United Nations Sustainable Development Goals: 1. Health and well-being, 2. Reduced inequalities, and 3. Economic growth. For the remainder of the presentation, I'll be elaborating on the key pillars of our logic model, including evidence and assumptions, inputs, outputs, outcomes, as well as external factors and unwanted outcomes. Although we planned backwards through our logic model to manifest systemic change, we will be presenting the pillars of our logic model in the forward direction. The assumptions and evidence that we've derived from our rapid review findings make up the foundation of our logic model. This is just an image of our Prisma diagram. We centered our search on the current fentanyl epidemic and existing harm reduction measures, but we placed an emphasis on fentanyl drug checking tools. We ended up including 35 studies in our qualitative synthesis. In terms of the diagnosis of the social issue, it needs to be understood that the opioid crisis is a highly complex, multidimensional social issue with a plethora of catalysts, including mental illness, abuse, intergenerational trauma, and most recently, the emergence of lethal synthetic opioids. Our group decided to focus on addressing one root cause, fentanyl. The reason for this is because fentanyl is responsible for the majority of overdose deaths in today's opioid crisis. Secondly, many drug users are unaware that their drugs are tainted with fentanyl, and they lack access to simple drug checking tools. Through our synthesis, we discovered a novel tool, fentanyl test strips. Interestingly, these test strips have very recently been shown to be safe, highly effective in detecting fentanyl, they encourage safer drug use behavior, and studies have demonstrated that both drug users and pertinent stakeholders are willing to use them. So how do fentanyl test strips compare to naloxone kits, a frontline overdose prevention tool adopted by Canada? Well, naloxone kits are effective in reversing the effects of an opioid overdose, but they're reactive, not proactive. This is problematic because if you overdose, the only way you will survive is if someone in the nearby vicinity finds you in time, has a naloxone kit, and has the expertise necessary to inject you with naloxone. Additionally, an overdose by itself can cause brain damage. Lastly, naloxone kits can be expensive for the government, ranging from $30 to $145. Fentanyl test strips, on the other hand, have the capability to prevent an overdose from even happening. They are user-friendly and cost 30 times less than a naloxone kit. Next, I'll be discussing our social innovation proposal, fentanyl test kits. Looking at the prototype on the left, our group proposes to construct fentanyl test kits that take the form of a pocket-sized brochure that includes a fentanyl test strip, a test tube, and user-friendly infographics on how to use the test kit. We believe these test kits would be most effective if incorporated into existing harm reduction packages, specifically naloxone kits. Regarding inputs, this innovation would require fentanyl test strips from a company in Ontario, plastic test tubes, cardstock paper, and a graphic designer and printing capability. Regarding output activities, we would first form coalitions with our secondary reference groups. Then we would incorporate our critical and secondary reference groups into the social innovation process using the ladder of inclusive innovation. Note that our critical reference group in this case is Canadian drug users of all backgrounds. Next, we would manufacture the kits, then we would create an awareness campaign for the kits, and lastly, we would distribute the kits and maintain record keeping for evaluation purposes. In terms of our secondary reference group and guiding coalition, these are the groups that we aim to collaborate with in developing the fentanyl test kits, but these are also groups that we hope will play a key role in distributing the kits as they are in direct contact with our critical reference group. We would aim to work directly with harm reduction agencies like StreetWorks and SafeWorks, as well as Boyle Macaulay Health Centre and Hope Mission. In the future, we would aim to work with Alberta Health Services to incorporate fentanyl test kits into existing naloxone kits. We would also seek to collaborate with local addictions physicians and public health experts, and we would also like to partner with pharmacies, health clinics, naloxone distribution sites, university residences, drop-in centers, and community libraries and bars to scale distribution. In the short term, our goal is that our critical reference group, Canadian drug users, become aware of fentanyl test kits, know where they can obtain them, and know how to use them. We hope to achieve this through an awareness campaign. We will evaluate our success on this front through qualitative interviews and surveys amongst drug users and through record keeping on the number of the kits distributed through our coalition partners. In the medium term, one goal is that there is large-scale uptake of fentanyl test kits amongst Canadian drug users. We will evaluate this through record keeping on kit distribution numbers. Another goal is that kits also encourage safer drug use behavior. An example of this would be using smaller amounts of a drug or using around other individuals. We will gauge this metric through interviews and surveys with our critical and secondary reference groups. Another significant goal is that these kits reduce fentanyl overdoses and the burden on the Canadian healthcare system. This metric will be evaluated by comparing Government of Canada data before and after our innovation implementation. With respect to our long-term systemic level outcomes, we believe our innovation will contribute to increasing societal acceptance of harm reduction as opposed to criminalization. We believe the innovation will effectively reduce community and family trauma from overdose. We believe the innovation will help promote drug checking practices as an overdose prevention norm in Canadian drug use behavior. And lastly, because these kits are intended for all drug users, regardless of severity, we believe these kits will reduce stigmatization attached to drug use. These outcomes will be evaluated through qualitative interviews, surveys, and observational studies. Two significant external factors that may hinder this project need to be considered. Firstly, the current government in Alberta recently released a negative report surrounding supervised consumption sites, and as a result, the current party will likely be resistant to funding additional harm reduction programs. Secondly, given the current COVID-19 pandemic, funding will likely be concentrated on coronavirus efforts rather than harm reduction, at least for the time being. In terms of unwanted outcomes, there is potential for individuals who use these kits to develop a false sense of security. Just because these kits can detect fentanyl and related analogs does not mean they can detect other dangerous drugs like benzodiazepines. Continuing along this line, although we believe fentanyl test kits could play a vital role in mitigating the current overdose epidemic, it is not the cure and needs to be integrated into a larger harm reduction package. There is a potential for drug users to develop an over-reliance on fentanyl test kits rather than naloxone kits, supervised consumption sites, and other overdose prevention measures. We aim to mitigate this issue by integrating fentanyl test kits with naloxone kits and including other harm reduction resource information in our fentanyl test kits themselves. In summary, the current fentanyl crisis is a major public health issue requiring immediate action as nearly 4,500 citizens die every year. A root cause of this problem is that drug users are unaware that their drugs are tainted with fentanyl and they lack access to simple drug checking tools. Our innovation proposal, Fentanyl Test Kits, provides a solution to this issue, allowing Canadian drug users of all backgrounds to check their drugs for the presence of fentanyl. Research demonstrates that fentanyl test strips are safe, highly effective, encourage safer drug use behavior, and are viewed positively by both users and stakeholders. In the medium term, our innovation idea has the capability to reduce overdose deaths and the burden on the Canadian healthcare system. In the long term, this innovation may generate systemic change by catalyzing safer drug use behavior amongst a diverse population of substance users. Moreover, this innovation may increase societal acceptance of harm reduction practices rather than criminalization of drug users. Furthermore, by reducing fentanyl overdoses, this innovation will likely reduce family and community trauma. Lastly, because this innovation is intended for all substance users, we believe this innovation will help reduce stigmatization. Finally, taken together, our innovation idea contributes to the United Nations Sustainable Development Goals of 1. Good health and well-being, 2. Reducing inequalities by providing drug users access to simple drug checking tools, and 3. Economic growth by reducing the financial burden on the Canadian healthcare system.